Hello, dear colleagues. How are you? My name is Mynzhylky Berdikhojayev. Қозғалмай жата беріңіз. Мен Mynzhylky Салашпын. Сізде судорога операциядан кейін болды, сол тоқтады ма? Одан кейін болған жоқ қой? Все, жақсы. Қозғалмаңыз. My name is Mynzhylky Berdikhojayev, and now we are planning the case number 3. The previous case is finished with the angiography, and now we have supply from the middle meningeal, and also we have some supply it's okay, I will show you. Нені? Проводникті алдымен дуоға салып қой. Так, и бүйтесіз. Шайхмет, мынаны қазір тұра тұр. Пока өткізбей тұра тұр, мен өзім келем. Yes, my assistant is Шайхмет Махамбетхан. Operating nurse is Бахат. And second nurse is Arzagul. Anesthesiology nurse is Sultanat, and the video support presented by Videon company, Videon KZ company. And today Roman Povyshev is in the control room. Okay. It's like maxillary artery. Okay. Over here. Yes, Roman Povyshev is video support. Evgeny is in Astana, and the second job, the main job of the Evgeny is video engineering, Evgeny Grishayev, and the Videon KZ company also doing drone show. They have 500 drones, and they're doing drone show all over the country in Kazakhstan. And it's very beautiful show. They're doing it approximately more than 2 years, and now okay. And now Evgeny in Astana, they did a drone show for the Women's Day, and that's why Roman is in the control room. Спираль бересіз 2-6 деген. Okay, we will place several coils. Маған жалғаса. Екінші система жалғап бере салыңыз. Yes, patient is жасы қанша, да? 60 years old, 60 plus years old. Жасын қарайсаңыздаршы, Бақыт? Пациенттің жасы қанша екен? Okay, now we are in the middle meningeal. We have 8 French introducer sheaths and 58 years old. Okay. Okay. Екіде 6 бар ғой, да? Okay, that's not Proper position. Okay, let's analyze together. This is the remaining part, but it's not the first. Okay, the right side. You can see there is a meningeal artery coming and stop. This is a cast from the first time, and thanks to Sheikh Ahmed, he did a separate extracranial and intracranial. Now you can see the meningeal artery is coming here, and then it's passing the midline and stopping here. It stops here, and it's not feeding the tumor anymore. Those branches are not going to the left side. I hope it's not goes. Huh? It's too big, and maybe okay, not this time. Patient after first session decreased in size, and the initial symptoms of 6 centimeter meningioma was headaches, and now headaches is released, and from the intracranial circulation there is no supply. This part is like a venous compression. Yes, the tumor is not supplying from the intracranial. That's why it's possible to follow. Okay, the meningeal circulation. Tumor is feeding this part from this branch. It's a tiny small branch, and here it's also feeding, and the main supply is coming from this branch. And the plan will go with the headway duo here, and headway duo 167 will place one coil here, then we will place headway 27 here and place coil here, and then we'll took the headway duo in this branch and place coils here. After occlusion, this distal part will navigate the headway duo to this branch, and will occlude this part of the meningioma. On MR, the most part of the tumor is necrosed, and the remaining part is still there, and the plan is to kill as much as possible the part of the tumor. And we decided to follow this patient after embolization without surgery. Okay? Huh? Yes, we will do MR, and then we will do final decision. Спокойно. Назад. Чуть-чуть. Вперед. Стоп. Okay. Yes, the problem is we have no material as much as we needed. That's why we should do with the adapted material, which is headway. Headway is good, but we have not enough sonics. The next cases, brain EVM cases. That's why There is a little bit angulation. We'll use head weight 27 for the navigation, for the embolization. Okay. The first coil will be lifted here. Just a second. Екі де алтын бере соныз. Бақыт, микроплексия. Ашар. Так, тағы да бір набор не бере соныз? Да. Лидокаин алып қойдың ғой, да?
Алып қойдым.
Все хорошо.
Бір набор шприц.
Я бір набор шприц. Okay. Now we'll place microplex coils. Microplex 2x6 helical to do pressure cooking in this branch. After placing this, we will go with the headway 27. Okay. 27 is not so soft and suitable, but we should work with the tools we have on the shelf. I think it's enough. Все, отдели. Бахт. Okay, let's see. Sometimes it's detaching, sometimes it's not. Еще раз. As once again, it's a headway 167. Okay, let's check. It's not detaching. Sometimes it's need this saline. It's not detaching. I don't know why, but nowadays it's a problem. It's a real problem to detach the microplex. Oh, achting görüyorsunuz. Okay, let's use the web one. Okay, now it's detached. Шахматны алып сесеш. Лақтырасыз. Okay. It's not so much, huh? Okay. Okay, let's place the headway 27. And бересің. Yes, today is the 9th of March, and in Kazakhstan, if the holidays like 8th March, International Women's Day, is a day vacation day. If it comes to the Sunday and Saturday, then Monday is a weekend. That's why today is a weekend in Kazakhstan, and we can work in a more comfortable position than if it would be the just a second. Ана ішіндегі ауасын шығарып тастайсайшы. Ішіндегі ауасы бар мына жерде. Ой, коннектор. Yes. As I'm joking, Sheikh Ahmed is a microsurgeon. Huh? I have a microsurgical assistant. Yes, in the morning they made a bypass. And yes, yesterday morning I arrived from the Singapore, and in Singapore, Professor Shubin from Shanghai did a presentation on bypass surgery, and he has the biggest experience, I think, in the world with the $17,000 bypasses done in the department. I think it's one of the experienced team nowadays. The problem is, okay, the catheter is coming. I don't know, I don't want to go there. We need to go here. No. Okay, it would be the wedge position. Okay, I will leave it like this. Okay, let's leave it there. Кончигіңді қарасайшы. Кончигіңді қарасайшы. Кончигі дұрыс па? Қарасайшы. Быт шығып кеткен жоқ па? Несін кигізесің? Okay, now February 27 in the branch. We can okay. We need to place one coil distally. It's nearly kaput, huh? Okay. Then I will ask to give me бақыт, ана жерде гибрид 7 деген бар. Мына жерде гибрид 8, астында қандай? 7. Осыны ашып берсеңіз. Шейх Ахмедке берсеңіз. Okay. Now the wire is in the position. Okay. Okay. Just a second. There is orbital anastomosis, huh? Check it. Yes, there is orbital anastomosis. That's why we'll place coil 1. Бақыт. Мына жерді қарайсаңызшы, спиральда тұр, микрофлекс. Былай тастайсаңыз. 1/4 ашып бересіңіз. Аша бересіз. 1.5/4. И, скорее всего, тағы біреу керек болады. Бір жерін просто. Дайындап қойыңыз, бірақ ашпаңыз. Okay. We placed 2/6 coil in the second branch, and in this branch we will start with the 1.5/4. Yes. Отделялкасын дайындап қойсаңыз. Ананы родмақ қойсаңыз. Серый керек жоқ. Стоп, осылай. Еще раз. Yes, there is not so much mass effect, that's why we decided maybe it would be possible to treat without. Maybe 1 coil is enough, huh? Или тағы керек болады. О. Бір жерінде екіні бересіз қазір. Okay, let's see. It's not detached. It's not detached. Just yes, the last coils coming from microvention from the teruma is not detaching, huh? Okay, ақпен көресіңіз. That's why time to time we're using detachment system from the web. Now it's detached. Okay. Second. 1,5-2 бересіңізші. 1/2 деген бар ма? Микрофлекс. Yes, now I'm asking Bachit to give me the 2/4 coil. 1/2 coil. Бересіңіз. You can place inside the previous coil. Сразу ақпен отделяйтесь ғой қазір. Yes, it's from the web detachment system. It's very surprising that microplex coils are not detaching. As it's a 167 centimeter headway duo. We asked from colleagues now we can detach. Okay, it might be better. Okay, now everything is detached. Is it? As much as possible, it is better to go to the branch to prevent distal embolization to the ophthalmic territory. Is it? Okay. Okay. Let's take hybrid 7. Which one is hybrid 7?
Just now.
I think this one is Chica 8. Chica 8 is nearly kaput, that's why we will take a hybrid. Yes, now we will do a little bit more J. It's not going forward. I think we damaged the wire. Oh no, it can't. Okay, I hope it will go to the branch. There is a 360 degree. It's a U-turn, complete. 90 degree? No, it's more than 90. Okay. We need to go to the orifice of the branch and then it's too soft, that's why it might be a little bit problem during the navigation. It's too soft. Wacht, тағы да бір чекай восьмерка ашып бере салшы. жоқ. Maybe now it will go. The guide is not stable. Guide is not stable. It's a Fubuki. We have no the other guidings, that's why I should work in this condition. Чекай, восьмерка вернешь? Okay. There is no support and no stability. Чекай, 008. Я, осы. Ол бірақ емес қой, 8 ғой. Ол 8, чекай, 8. Жоқ, соған восьмерку. As now the coil is migrated. Okay, let's try to go with this one. But the hybrid 8 might be needed at the end. We'll see. Let's shape it. If it will not go, we can inject from this point. Шайхнет. Предыдущий ангел корриж. Yes, it's possible to inject from here.
Why?
Ошо көрсе болды, анан неге қоясың? Smart mask. Турки вылезу. Все. Вроде как да. Уши көрсе болады, уши көрмей жату. Жоқ, майыстыр үшін. Просто өте жұмсақ. Чекай бләк сияқты бірдеме керек та бұл жерге. Yes, the problem is the catheter is a little bit stiff and the wire is a little bit soft. It's a problem. The catheter is a little bit stiff, that's why it happens like this. Okay. Okay, we can inject from here. Let's see the circulation from the headway 27. Yes, it's also filling some territory. I will pull the catheter a little bit. Now it should be better. Okay. Smart mask. I will burn a little bit back. Maybe from this point it will be better. Так, дым соберется. Подожди. Я дым соберешь. We'll inject the missile from here. Tabr dым сожженесл. We'll inject lidocaine from the 27. Бірінші эмболизат не вот. Бір фил ашып бересіңші. We'll start with fill. В принципе, она начнет ДМ собор. Fill 25, we will start with fill 25. And then we will take a squid 12. Squid 12 жинап бересің. We'll start with fill and then we'll inject the... Обезболить лорноксикан бересіңіздер. Okay, now I will inject Demisol first. It's a 27 headweight. So the 27 headway will inject fill, and through the headway do 167 we will inject squid. Бересің, squid. Glue қоясың. Okay, let's put the glue. First of all, we will inject squid. Апа, қимылдамаңыз.
Қимылдамаңыз, кішкене шыдаңыз.
Так, қимылдамаңыз, апа. И так көрінбейді еще. And the dead space of headway 27 is a little bit bigger. That's why I will inject like this. It's not arrived, huh? It's quite fast reflex. Okay, еще раз. It's not going forward, it's going backward. As the most of the material is inside the dead space. It's reflection. Okay.
Teksa, unik.
Unik just is. Okay. Now I take out 27. I hope it will go forward. Ладно. The some part is reached the feeding branches. I'm going backward. Okay, let's wait a little bit. Yes, now we included the main part of feeding middle meningeal, and I hope the tumor will be necrosed. Медленно вперед. Yes, it might be. Some pieces of fill is reached the meningioma, the distal part. And the proximal part is fully occluded. We have MRI before the hospitalization at this session, and then we can do the MR tomorrow with contrast. Yes, tomorrow. Tomorrow.
Not too much contrast.
MR. MR. Yeah.
It's contrast.
Contrast enhanced. Yeah. Or we can do MR on Wednesday. No problem.
Да.
Okay, it's coming back. Usually it will not go, huh? At this point we can stop. Okay, let's try to inject after 2 minutes. Let's wait 2 minutes. If it will go, it will go. If it not, then we can stop. Okay?
No, начало толгон. На осла.
Мынау тамырдан барта былай толды. Okay, let's check which part were before, which part no. Okay, let's put the first before the embolization. It was like this. Let's put it, it was before. And now the small piece is migrated here. At this point, you see? This one. This one. Okay. Let's takes nearly 1 minute. Трудно, еще раз. The fill first technique works very well, but I'm not sure in this case it will work the same way, because the backwards, yes, it's a case for mini scepter and the combination with pressure cooker. Okay. Even like this, I think we reached the goal of the treatment. The ophthalmic artery is secured and the meningioma was embolized. Yes, there is no feeding. It's here. Yes, it's avascular zone, and we can orient from the MR with contrast. I hope we can follow this patient. Maybe the small part is a little bit contrast. Maybe this small part is still contrasted. Let's see. Application. Express CT. 10-second low dose. Okay. As the lateral dislocation is also decreased, that's why we are not in a hurry. We can wait a little bit. Huh? It was 1 centimeter dislocation, now it's less than 1.2. Now it's less than 7 millimeter and the symptoms is released. That's why we will do MR and then we can decide. Okay. No. Okay, Shehmet will do control CT. Let's wait for the CT control. Just a second. Ауырғанын басылады қазір. Тістеріңіз көрсетіңізші. Хорошо. Көріп отыр көз. Все. Жасай бер. Okay, dear colleagues, now you can see the upper part of meningioma. This is embolized part and this is lower part of the meningioma. it's occluded as much as possible, and now we can finish the case. In a couple of days we will do MR control, and if the meningioma will become dark during the contrast injection on T1, then we can follow. The symptoms start released. The edema peritumoral is also decreased. It's not totally decreased, but it's much part of the edema is decreased. That's why we are not in a hurry. She's 58 years old. We can follow a little bit. Okay. Thank you for watching. The next case is brain AVM, right frontal region AVM. Probably we will go transarterially and transvenosely. See you in next 30 minutes. The case will be under general anesthesia. Thank you.